Good morning and welcome to Monday Mornings with Margie. Happy to be back, and I have a special guest today. Our focus today is going to be on the veteran population and mental health issues that come up specifically with the veteran population. And I have a special guest, Dr. Abuada, who is here with us today, and I'm going to let her introduce herself to you all.
Hi, good morning. Thank you for listening to us today, and thank you for hosting me, Marjorie. Today is, I'll start by telling about myself first. So my name is Dr. Abada, and I am a psychiatrist and a family medicine doctor, and I have worked with the veterans at the VA in different settings. I'm based in Iowa. Mm-hmm. I also practice integrative psychiatry in addition to that, which involves a lot of mindfulness practices, body-based practices. That's more of a holistic approach to the care. Mm-hmm. And I am originally from Israel. And so we have our share of dealing with lots of things that come up there with trauma. And that was part of the reason that drew me to also working with the veterans, because I understood certain things that they went through that had I been a civilian in the States, I would not have captured, or even just a little bit of the nuances that you wouldn't get unless you've been in the military and had that experience. So,
okay. So let's jump in. So, I want to have you explain some of the basics first. So, for people who aren't familiar with mental health with the veteran population, what are the most common diagnoses that you see in your time working with this population?
Yeah, so there are a lot of common injuries that happen depending on where they served and what they were exposed to, and what generation they were. And so if they're exposed to like chemical orange, later they develop diabetes. Depending on the impact of trauma that they had, they end up with a lot of back injuries, knee injuries, but that's more on the physical side. On the mental health side, number one that I've seen is traumatic brain injury. And it presents to us with mood swings and mood changes. A lot of it is trauma happening to the brain in the middle of an injury while in service. The others are post-traumatic stress disorder, and then depression. And along with that comes in the piece of pain. With all the injury, the veterans end up with chronic pain. And then to cope with that, and then being prescribed opioids, they end up with addiction too. So whether it be addiction to alcohol, whether it be addiction to opioids, it's both a lot of times.
Yeah, and so talking a little bit about, I guess I was going to talk a little bit about PTSD, but why don't we talk a little bit about dual diagnosis? Because I think that kind of ties into what you were just saying. If you could explain to people a little bit about what dual diagnosis means and sort of why it occurs.
Yeah, and we use these words dual diagnosis because traditionally in the mental health system and with insurance and payment and all that, they like to keep it separate. They like to keep mental health. So that means having depression, having anxiety, having bipolar disorder, PTSD, all these are mental health diagnoses. The system likes to keep that separate from addiction. Addiction is when somebody becomes dependent on whatever drug it is, and they need to keep using it more and more and creates problems. So that's having both of them. So dual diagnosis refers to somebody having both a mental health diagnosis and addiction at the same time. A lot of times it is hard to know which one is a chicken and which one is the egg. And so whenever we keep saying, oh, it's only depression, or no, it's only addiction, we're not asking the whole story of what happened.
Sure.
There's usually a lot more than one diagnosis or the other. There's a lot of time the dual, mental health and addiction.
Absolutely. We run into that a little bit with TMS as well, when we're treating people with depression who are newly in recovery. And sometimes insurance companies want a certain length of sobriety. And I understand it, but part of what causes people to relapse is they become depressed and they go back to the addictive behavior. So it is, very much, they're very much tied into each other. So let's talk a little bit about post-traumatic stress disorder. I guess more in layman's terms or laywoman's terms, how would you describe post-traumatic stress disorder? Because we hear a lot about it, but I don't know that everybody fully understands what that means.
Mhm. The way I think about it is when an event happens, for that person in that moment of the event, if they felt that their life was threatened, they felt they were not safe, they felt they will not could not control things and feared for their life, that is a traumatic event. There is a big T trauma and a small T trauma and all these things, but regardless of the event, it's the perception and the description of that person in the event that is very important. So that's number one. As a result of that trauma, whatever that trauma happened, then the person reacts in certain ways. And so that can be, we talk a lot about fight, flight, or freeze. So that can be as a result of that, the person wants to run away constantly from whatever happened, or they feel like they want to freeze, meaning they want to shut down. That's when they say, I'm numb, I don't enjoy things, I don't want to be here. And then there is the fight. And that's where, because of the trauma, the nervous system wants to fight. So the arguments, the angry, the destroying things. So that's kind of the response to the trauma.
Mhm.
There is also a fourth one that they talk about in mental health called fawning, which means kind of faking your response. So if I'm afraid that if I show you really my feelings, you're going to re-traumatize me again, I'm going to put on a facade and I'm going to answer you whatever you think you need so that I can escape from this trauma right now. So
Interesting.
mhm.
So, what are some of the most common symptoms that people experiencing PTSD? Because there are people who have traumatic events occur, but don't necessarily develop post-traumatic stress disorder.
Mhm.
Because going back to what you talked about, the whole perception of the event also impacts things. So, somebody who develops PTSD, what are some of the most common symptoms you see as a psychiatrist when you're diagnosing this?
Mhm. Yeah, I think of it in terms of two ways. Either what I call the hyperactivation, so that's more of when somebody is always on guard. Think about it this way: a bear is coming at the person, and you need to figure out what you're going to do. So if there is that fight response, the symptoms are there is heart racing. So some patients will say, I'm always anxious, my heart is racing. There is that kind of anger response and mood swings that come with that.
Mhm.
Then comes the being on guard, hypervigilance.
Mm.
So you're always kind of scanning your environment, you don't feel safe, you don't know what's coming. Um, that's one component of it. And the other component is more of affects the sleep. So a lot of people will say, I have nightmares, I can't sleep, I can't sleep.
Mhm.
Um, the other thing that comes with it too is avoidance. A lot of times the name of the game, what I call it the name of the game, it's not a game, but when I would meet with the veterans, it was always the name of the game, avoidance.
Mhm.
You want to avoid whatever it is at any cost. So if sleep brings back memories of when the bombings happen and the attacks, you're going to want to avoid sleep. If driving down a road somewhere reminds you and brings back memories, you're going to want to avoid it. So avoidance is the name of the game. Um, and then the other last one is what I call intrusive thoughts. You don't
Mm.
even feel safe in your own mind because you keep having these thoughts, you keep having these images. It's like you never left that event that
Mhm.
happened. It's
Mhm.
with you every day.
Yeah. Yeah, and I mean, it makes sense for people who maybe didn't have addiction issues prior to this. If you think about if that's your daily experience, you
Mhm.
know, every day you're feeling hyper vigilant and you're having intrusive thoughts and you can't sleep, um, and loud noises scare you, or whatever the case may be, you would understand why someone would want to either escape or dampen down or perceive that they could dampen down by the use of substances. So talk a little bit about addiction. So people understand maybe the difference between, you know, somebody who's, you know, drank too much versus someone who has an addiction. What sort of makes something cross over from someone who drinks or, you know, maybe they smoke pot to go to sleep, whatever, versus somebody who has more of an addiction to something.
Mhm. I think about it as in terms of the intention of behind using the substance, and then the control, and then the impact on life for the person, for relationships and things like that. So intention being, what is the reason behind continuing to use and not being able to stop? Is it because of pain? Is it because of depression? What is the intention of using it? The second thing is inability to stop. You lose control. So maybe your intention at the beginning was, I'm feeling a little bit down, I'm feeling a bit anxious, I want to calm down. And then the control kind of gets in the place of like, oh, wait a minute, I can't stop. I don't want to stop. I can't control. I have to keep increasing and increasing. And after the control or loss of control, then results the problems with their relationships, the job loss, the legal problems, the arguments with people's relationships and divorces. And then a lot of times ends up in the legal system as a result.
Sure.
Yeah.
So what, what would you say when you were working with people, were sort of how you saw things, their lives impacted on a daily basis or overall? One thing I think about sometimes is when, I watch a lot of sports, and I might be watching a basketball game, professional basketball game, and they'll bring in a veteran from Afghanistan or Iraq who's, standing out in the court and everybody's clapping and waving. And I wonder if, like, in that moment, like, I'm sure they're appreciative of everybody clapping, but I wonder for them what their experience is in that moment, and what their experience is like coming home from war, or places where you were trying to keep yourself and your comrades alive on a daily basis, and seeing things that many of us will never see in our lives. So I'm curious as to what you see, how it impact their daily lives and sort of their life overall.
That one is interesting because in mental health, whenever I've worked with the veterans, they were not the ones that sought the care. They didn't think their lives were impacted. For them, they were making it work. And that's where it comes, where I keep saying, the avoidance is the name of the game, because for them, if I'm able to avoid it and I'm not feeling it, it's working for me. Never mind that I'm getting divorced, I am not able to keep a job and all that. So for them, it's a different take on what works and what doesn't work. It's a lot of that kind of survival mentality of, can I protect myself at any cost, regardless of what society views or anything else? Can I protect myself and my comrades? So you kind of ask me how the impact is. For them internally, it's a different perspective. On the outside, so for me, when I'm sitting on my side working with the veterans, a lot of times they end up with the drug court. Drug court is when a veteran had multiple legal issues and they're going to go to jail. The drug court is their last ditch effort of, let's try get you help. I know you didn't get help, the system didn't help you, but let's try get you help. So then the drug court comes in to help them to get treatment for the substance use and mental health. So they're not having to pay for it through a legal system without addressing the problem. So that's one impact that I see, is the legal ramifications. Other one that I see is homelessness. About 11% of the homeless population are veterans.
Wow.
And part of it is the mental health and the substance use. But then part of it too is they don't feel safe anywhere. And then because there are resources to get housing and all that, but it's kind of like you're asking a veteran who can live out in the wood, camp out, have a camper, start a fire, and be okay, to go trust a little apartment where they can hear and see other neighbors and all that. It's like you are asking them for too much. So on our side, on the outside, we see homelessness. But I've had veterans, I'm like, here's the services for you to get a place to stay. And they're like, I don't feel safe. I'm not going to do that. I am choosing. But sometimes it's not a choice. I understand sometimes it's resources, but sometimes because of that lack of safety, other impacts that I've seen are relationships. Usually when I met with veterans, there's a lot of divorces. It's the weight on themselves and the families is huge. And I know we always talk about the veterans, but their families, their kids are the ones that suffer such impact on them. And I've seen the families, they try to bring the veterans in for help. They try. And there's a point where they can't do it anymore. And then the veterans kind of self-resign. And so these are kind of the impacts that I see. And then other things is they isolate more. So these comrades that they were together in combat, that's how they survived together for each other to get through it. They come back, they feel like they're broken, and they don't want to reach out because they want to be able to fix it themselves before they reach out to somebody else.
Mm,
And so now they're even more isolated, not connecting with other veterans.
mm,
And then comes in more substance use to numb and cope with all of that. So these are all of the impacts.
mhm.
Then you were talking about what is it like for them when they come back, because we say thank you for the service. We are appreciative. But what I've always heard from the veterans is like, um, you don't understand.
Right.
You
Right.
do not understand. And I kind of always thought about it as the way that the language that was used is it's like two different cultures. There is the civilian world
Hmm.
and there is the veteran world, and they are not the same at all.
Right.
And then the other thing is, um, the veterans have all these what I think of as transferable skills. You
Hmm.
get taught all these skills, and then when you come back to the civilian world does not validate them, doesn't use them, doesn't think that they are important.
Mm,
And so then already you come back feeling different. You think you could contribute, but the civilian world looks at you like, you're not speaking our language. You have to change to fit back with us. We're not going to change as civilian world to fit you back into our world. So it's
mm,
like this cultural divide
hmm.
uh,
Hmm.
between the civilian and the military world when they come back.
Right.
And yeah, so I usually the veterans they don't want to they appreciate being thanked, but they also have this mentality or this. I used to use the words calling when I would talk with the veterans because I would ask them, why did you choose to serve?
Hmm.
Especially the young ones. And they
Hmm.
would tell me, why wouldn't you serve?
Mm,
It's this calling to be able to serve. It's a calling to be able to protect.
mm,
And so it's something in them. It's a great calling. And then when they come here, they're not asked to protect. They're not asked to fix.
mm,
And they're just this kind of divide between the civilian world and the military world. And nobody seems to see them on both sides. And
mm.
it's an isolated world. It's
Yeah.
difficult.
Yeah.
Yeah.
It'd be interesting if, I guess I'm just thinking out loud, but if, our government, um, whether it be state or federal or whatever, uh, was able to figure out ways to help integrate uh, veterans back into the system, um, and utilize these transferable skills versus make them sort of have to shift to come back into our world. How could we utilize what they have to offer? And, are there ways of creating opportunities in our country that allow them to slide back in, but still feel like they're giving, because we all want to contribute. And
Right.
if you're a veteran, you clearly want to contribute to your country. And so that must be hard when you've contributed and then you come back and you feel like there's no opportunities for you to contribute.
Yes.
Um,
And yeah, and there are like in the VA system, there is like a few weeks, a few months kind of introducing people slowly back into civilian life, but it's not a sustainable thing.
mhm.
It's just a few weeks, a few months, and then you're out of that. And
Yeah,
that doesn't, culture is something that is all per se, pervasive. It is not just one program that you finish.
right.
And there are veterans that, what they ended up doing, and I admire that, is they will create businesses and to hire veterans. So if
Yeah,
somebody learned a skill to be a mechanic of cars or airlines or whatever, some of them, they would start a business like that to hire other veterans.
yeah.
And that speaks to other veterans because the way I've heard it is that it's kind of like their work ethic too from the military.
Mhm,
It becomes a really great work ethic. And then they go work in the civilian world and they're
mhm,
like, what kind of ethic is that? You
mhm,
know? So
mhm.
then when a veteran gets hired back into somebody else who is running an operations and who is a veteran, they have this shared cultural code of
Right.
how you run a business, how you show up on time, how you do all these things that we don't appreciate in the civilian world unless we'd gone through it. And then other
Yeah.
things that veterans have done too is um, in general. So even with there are places called vet centers. Vet centers are separate than the actual VA. And the vet centers started because when the veterans were coming back from Vietnam, nobody understood what they were talking about.
Mm,
We called it shell shock. Now we have a word for it, PTSD. But they were experiencing all these things and nobody knew. And among each other, they shared the same language. So they created Over time, this vet center that became the support system and resources for the veterans. Later on, the VA came on board, and now the vet center works with the VA. But the vet center was initiated and created by the veterans for the veterans. And then
Wow.
other things the veterans have created too is, I forget what the program is called, but basically like a trauma response. So when it was like Katrina, when there are all these different disaster reliefs, the veterans do come together and they created, I forget what the organization was called. So instead of waiting for big organizations to come together, they're able to. But the challenge is, how do you get people together? How do you be feeling okay enough to do it?
Right.
Oh,
Right.
yeah.
Interesting. So we talked a little bit about, you know, symptoms and sort of how their lives are impacted. What are some of the resources? What are the things that you've seen that have been helpful? Resources for them, also resources for the family?
Mhm. It's been always, it's difficult because in my mind, why would you not want to get support from people that have shared your same experience? Because it always encourage the veterans to go back to like the vet center. The vet center is a great resource. And actually the vet center is usually staffed by other veterans that went through things too, from peer support and all that. So I would start with the vet center, contacting the local vet center, looking it up and finding it, and seeing who is your peer there that you can talk to. I'm saying that, but it is hard for a veteran to do that. So by asking veterans to sit together in a group and talk through things is very difficult. You know, they didn't, when they signed up to serve the country, they signed up to get the job done, not to talk and process all these things that happen. So the resource, one of them is, like I said, the vet center and having peers and being in a group. But there is a challenge to being able to ask for help. So that's number one. The other ones, the VA has a lot of apps, and I like these apps. And I noticed the veterans, especially the younger ones, they like it because it's very much self-initiated. You can do it at home. You don't have to be meeting with anybody. And so some of their apps are, one is called PTSD Coach. Another one is called CPT. CPT is Cognitive Processing Therapy, and that is the standard of care when we do therapy for PTSD. So yeah, on the one hand, they can meet with the therapist and do it, but if they don't want to leave the house, be with somebody else, with the CPT app or coach, they can start it at home. Another one that I like is a Mindfulness Coach too. Again, the same thing of like kind of, you're doing it at home. You're not having to leave the house, be with people you don't know in a place you don't feel safe. You can do this at home.
Wow.
There's also another app that I like, and it's for PTSD Family Coach. So that one brings on the families together. And then there's also, I mentioned to you, another resource is the Veterans Court. So if you have a loved one who's struggling with the court system and addiction and mental health, look up where your veteran court is and ask what you need to do to get your loved one involved with them, to help them get the help that they need. You know, there's the suicide hotline. If people type the VA suicide hotline, it's available 24/7. They'll talk you through it. They will call you and follow up with you. It's not just this one-time call. And then there is, I like the Wounded Warrior Project. That one is created by veterans. That helps also with rehab resources, kind of thing. And then through the VA, patients can ask for peer support, because peer support are the ones that have gone through it and they can help you through it too.
Right.
So these are kind of the resources that I can think of.
Okay. I've seen some things about therapy dogs as well.
Yes.
I don't know what that's through, but I know I've seen stuff about that as well.
Yeah, and the Wounded Warrior Project, is my understanding, is that they can help veterans because the veterans would go somewhere, train with the dog.
Yeah.
And yes, this is like the crucial, yes, the service dog is very important.
Yeah. Great. Well, you know, I feel like there's a lot of bureaucracy, I know, within the VA system, but I feel like as a country and a system, there's so many ways we could do right by people who have served our country. And I think these apps, like you talked about, I didn't know about those. I think those are creative ways. And I feel like there's got to be other innovative, creative ways to help support the mental health, but also the, the occupational end of things, the relational end of things. How do people integrate back in and feel important and significant in their country that they served? So, well, thank you for sharing, your expertise in this area. Is there anything else that I left out? Any questions I missed, or anything else that you think is important to share? Or do you think we hit the main points of this?
I want to tell you that anybody who's listening to this who is a veteran or a family member that has a veteran is that you're not alone. To always remember that you're not alone, and to I want to say reach out, but reach out is hard to do when you are not feeling safe.
Mm-hmm.
But what I would say is, what would you do for one of your buddies?
Mm-hmm.
That's the message, because that's what get people through.
Mm-hmm.
Is their teammates, their comrades.
Yeah.
So what you would do for your friend, bring your friend for help. Maybe not yourself yet, but at least your friend.
Mm-hmm.
Connect them to somebody.
Yeah. Well, thank you for your time today. I think that was an important message to share with people. And we'll have to have you on again at some point to talk more about integrative mental health and that aspect, because I think that's also, a separate issue, but really important to talk about. So, so thank you to all our listeners and our watchers. I hope you have a great week and be well.